Whoops.
Hello, everyone. We are absolutely thrilled to have you here today. I'm Jody Smith. I'm your program director for the Mended Hearts Inc. We also have Tammy King on the line from Mended Hearts, and she's going to be working with us today. And I'll introduce you to our wonderful guest in a minute. But this program, so this is part 4 of a wonderful 4-part series. If you haven't seen the other 3 parts, they are on nutrition, kidney disease and cardiovascular disease basics, and we also have a fabulous patient panel. You can go to our YouTube channel and you can watch them on there. You can also go to www.mendedhearts.org and you can see them on there. It's been a fantastic series, and this is our last of the 3 series on managing chronic disease. And we purposely put this one in Mental Health Month, Mental Health Awareness Month, because managing chronic disease has a lot to do with mental health, as you'll hear. So a little bit about this webinar. All attendees are in listen-only mode. If you can't hear, check the audio button or the speaker on your computer or device to make sure the sound is on. We're hoping you can read this if you can't hear. So obviously you're not hearing me say that, but it's probably on your end. So check it out. Unless I get a bunch of messages in chat saying we can't hear, it's on your end. Please type your questions. If you see there's a box called Q&A, please type your questions in there and not in chat. If you have a comment like that's an interesting idea, that's fine. Type that in the chat box. But if you have a question, please type it in Q&A, and either Tammy or I will read the questions at the end of the presentation. And also, we are recording this presentation, so a recording will be available on the Mended Hearts Inc. website and our YouTube channel following the event. So you're in luck. If you miss it today, you get to watch it another time. We also wanted to greatly thank our partners in this, AstraZeneca, because they have given us a generous educational grant that allowed us to do this entire series. So we've been very fortunate to work with them, and I think you will find that this has been an exceptional series, and so we're very grateful. I am going to stop sharing my screen because Diane and I are going to have a conversation, and I want to introduce you to Diane Bearman. Diane, can you start by telling us a little bit about yourself?
I think the most important thing for today to know about myself is that I have been working since, it's hard to put an exact date on it because I've been around the University of Minnesota Medical Center for so long. Most of my life, it feels like, much of the time. But since 1999, I have been working as a clinical health psychologist at the University of Minnesota Medical Center. And so I have had the privilege of meeting with people with multiple different medical conditions, and as well as people in the hospital, in outpatient settings, and have worked with many, many people with many transplants, including heart transplants and kidney transplants. So of course, I've worked with people also who have been in the process of being evaluated for those possible surgeries, going through the waiting, going through the uncertainty, going through the decision-making. And I have learned a lot and hope to share some of that with you.
Well, we know it is an impressive background, and we know you're going to share all sorts of great information with us. So in terms of this topic, managing, and we talked about managing chronic kidney disease and cardiovascular disease together, is not just managing one, but 2 chronic diseases. And that can be really difficult for people. So can you tell us a little bit about why this topic is so important to start out with, and then we'll get in the nitty-gritty of the what.
Right. Well, first of all, I want to say that when you're living with a chronic illness, this is something that you did not expect. This is something that you did not want. And so in many ways, even though you may have been involved in your healthcare over your lifetime until you started developing symptoms of a chronic illness, even though you're familiar with your doctor, with your clinic, with all of that, getting a diagnosis of a chronic condition, which of course you know better than I, means that you're going to be dealing with it. It's not like getting the flu and you get over it.
Yeah.
It's more like, to just put it into contemporary terms, it's not getting COVID and having a mild case and then recovering and going on with your life. It's more in the realm of what we are now calling long COVID.
Mm-hmm.
It's chronic. It's going to keep affecting you. It's going to keep having an impact on your life. So I have often used the analogy that getting a diagnosis of a chronic illness is like all of a sudden waking up and you are in a different culture, you are in a different country. There's a language that you don't know. There are customs that you don't know. There are expectations on you that you don't know because it's a foreign culture. So step one, the most important thing about managing chronic illness in my mind is educating yourself. Learning, what is this culture that I'm dealing with? What is the language? What are the customs? What are they expecting of me? Or else I won't have any idea if I'm doing the right thing or not. And the other part of that education piece is educating my important people, because they're going to be going through this culture with me, even if they don't know about it yet. I'm going to be grabbing them by the hand and bringing them in with me. So that means that you have to seek information. You're going to have a lot of stuff thrown onto you. You're going to be inundated with information. I've spent a little bit of time, not enough, on the Mended Hearts website. And for example, there's fabulous information there.
Right.
And
there is.
and yet it can be so overwhelming. So reminding yourself that you don't have to learn it all at once. Bite by bite, piece by piece. It reminds me of the old elephant joke, and maybe only people as old as me know about elephant jokes. But how do you eat an elephant? Well, one bite at a time, because that's all that you can take in. So that's the start. That's the basics of why is it important to learn to manage, because if we want to maintain our health at the highest level that we can, educating ourselves is important.
Yeah. Well, I know that, so I appreciate, how much people often don't realize, like you said, how much this impacts every aspect of their life. And some of the people on here are going to be caregivers, and they're dealing with a loved one with a chronic disease and as well, and it impacts their lives too. And so I think educating yourself is good for both of them. What are some of the other things? I know you have a whole series of things that people should know or can do, or helpful tips, I guess, in managing.
Yep. Well, I want to start out just with a very, very brief focus on just why is it important? Why is it important for our well-being? Why is managing the physical aspects relevant to our emotional well-being? And the fact is that emotional health and physical health, they're all happening in the same body, and our brain controls everything. So this separation in Western culture that we have all probably grown up with of, oh, well, that's only in my mind and that's only in my body, that's really not true. So I want to start out with a little bit of just some basics of emotional issues that often come up within chronic kidney disease and cardiovascular disease, and how they affect one another and why it's important. So just very briefly, the prevalence, the incidence of depression and anxiety in general in our American population is pretty high to start with. However, and I'm not going to throw a lot of numbers at you, so don't worry about that. But the estimates, for example, in people with chronic kidney disease are as much as 5 times higher. And I should say, the way I saw it cited was the talking about end-stage renal disease. So this may be the very severe end of chronic kidney disease, I can say, but the estimates are that depression in that population of people with ESRD can be as much as 5 times higher as the general population, and in cardiovascular disease as much as 3 times higher. And anxiety, the estimates are a little less specific. I think possibly because we don't think about anxiety as being as much of a severe condition, because to be honest, depression can be fatal, right? People can take their own lives. Anxiety can exacerbate physical health a whole lot, and it often comes connected with depression, but I don't know that it's always considered as dire as severe depression might be. But just some examples, and I want to just say, I'm looking over here because I had pulled it up on the Mended Hearts website, one of the sources of great information. Depression affects everything in your daily life, including recovery from a cardiac event. So there's a lot of good stuff there, and I'll just give you a little bit of a list of some specific physiological impacts that depression and anxiety can have on cardiac function. It can increase the rate of arteriosclerosis. It can increase cortisol levels, and I will just say anxiety, woo, cortisol levels up to the sky, and that can lead to increased blood sugar levels and increased blood pressure. It can also lead to increases in other hormones that affect resting heart rate and lead to a greater increase in heart exertion. And it can also lead to increased activity of platelets that can accumulate, and that's part of what goes into plugging up arteries. The other, really, from my perspective as a mental health provider, one of the most important things about the impact of depression and anxiety on your physical self is that it can, first of all, lead us to do things that are not necessarily healthy, and that we have less ability, if we are dealing with depression and anxiety, we have a lot less ability to remind ourselves that we really, really, really do need to not start smoking again. We really, really do need to eat healthier food and cut back on the butter, or whatever our physicians have encouraged us to do. And with chronic kidney disease, there can be really significant dietary restrictions, and that's really difficult to follow if it's different than what we're used to. So all of those things, depression and anxiety are highly correlated with having more difficulty following our medical recommendations. If I have a recommendation that my health will be so much better if I move more, if I'm more physically active, but my depression is making me stick to the couch and not want to get up, that's going to have an impact on my physiological health. So those are some of the really direct reasons that it's important to manage and monitor our emotional health as well as our physical health. And then there are the many, many things. So how do I do that, right? How do I do that? Because here I'm in a situation, all of a sudden I was given this diagnosis that I cannot change. And so I'm in a very uncertain place, and it feels more uncertain than it has ever felt in my whole life. I have no idea what's coming at me. And it's really difficult at a time like that, when you've been given this information that you do not want, and you really just want to plug your ears and sing so you don't have to listen. It's really difficult to remind ourselves that actually human existence is always uncertain. We have no idea what's going to happen. We have so much less control than we like to, is it fair to say, pretend to ourselves that we do? So learning about what we can and what we cannot control is the place that I always start, because it just makes sense. If I'm spending energy fretting about, worrying about, trying to figure out how to make things change when it's something that is completely out of my control, then I have less energy to do the things that make me feel good, right? So the example that I always use, because I grew up in Minnesota, where I still live, and so the example that I always use is the weather. I may not like the fact that it snows and can get really, really cold in April, right? But I have a choice. I can either be really ticked off and say, no, it's April, it's spring, I'm not taking out my winter clothes again. And then I will really have an uncomfortable day because I'll be really cold. I will have wet feet. And I'll be angry. I'll be really angry all day. It's not supposed to be cold. It's not supposed to be snowing. So I'm going to suffer more if I don't get clarity about the fact that I do not control the weather. So being angry about it is just wasting my energy. So how does a person get to the place of being able to accept that there are things that I cannot control? And I know that for some of us, it can be easier than for others. There are those of us who have personalities and past experiences where we've always had a lot of control. Life has been.
I think most of the heart patients are type A personalities, Diane. I really do.
You know, I've had control. And not only that, but I'm used to being able to make the decisions, the important decisions about the things that affect me. So giving up that control is really difficult. And I will just say very briefly, the tool that I find the most helpful in reminding myself that I have to learn to differentiate. And every situation, I'm going to have to read the situation and determine what is there here that I can control? What is there here that I cannot control? And I'm guessing that most of you are probably familiar with something called the Serenity Prayer. And that is a tool that I've just happily stolen from 12-step programs, which are very prevalent where I grew up in Minnesota. And it goes like this. Grant me the serenity to accept the things I cannot change, the courage to change the things that I can, and the wisdom to know the difference. So there are longer versions of it for those of us who have a faith life that is important to us. We can make that into more of the prayer that it was originally written as, but it doesn't have to be for those of us who do not have that faith and that connection to a faith community. But that's an important thing to remind ourselves of. There are things that are out of our control. And if I am brave enough, I'll be able to work on the things that are within my control to change. But I have to be wise enough to know the difference. So that's how I learn and how I try to help people learn to deal with uncertainty. The next word, though, that I'm going to focus on is one that I shouldn't say usually, it often makes people get really, really upset, and that is acceptance. And acceptance is part, I think, and very related to expectations. Expectations that your healthcare team may have for yourself, expectations that you may have of your healthcare team. And again, connecting it back with what is or is not in my control, acceptance of what is not in my control. And that's going to make this process that you are now in, this foreign culture that you are not in, a little bit easier to navigate. And it's that word of accepting that people have incredibly strong reactions to. I remember working with people who would, and I still do, who simply say things like, I'm sorry, but you will never convince me to accept the fact that I have type 1 diabetes. It's just not going to happen. And my response to that is, how is that helpful? Not accepting reality. It's kind of like, I go back to the weather. I don't have to like the fact that it snowed in April. I like the fact that Prince wrote a fabulous song about it, but I don't have to like the fact of it. But if I don't accept it, I'm going to be cold and I'm going to suffer. And the same thing is true if I don't accept that I have type 1 diabetes. I am going to have high blood sugar and I'm going to be sick all the time. And the same is true in any situation of things that are out of my control. And then frequently I get told, but it's not fair. And I agree with you. Yep, it's not. And I will then say, is focusing on the fact that it's unfair helpful? Well, yeah, because I'm really ticked off. So that makes me feel better because it's not fair. And the related phrase that often comes along with it's not fair is why me? And I'm wondering if I have a little bit of time to tell a story.
Yes, you do.
About
we're good on time and we'd love to hear it. Yeah.
It's easy to fall into why me. And that comes along with anger about how unfair it is. I have always appreciated something that I heard about holding on to anger with the hope that it will harm the person or the situation or the disease or whatever that I am upset with, that is triggering the anger. Holding on to that anger and hoping that it will harm whatever or whomever triggered the anger is the same as drinking poison and hoping that it will hurt the other person. It's only going to hurt me if I hold on to anger and that sense of unfairness. It may not be fair. It probably isn't fair. However, that's the way it is. That is the reality of now. So what's my choice? And again, I must be a real stereotypical Minnesotan. I use weather analogies. I have to learn to keep my balance in the wind. I have to learn to keep my balance. I have to learn to manage how reality affects me so that I can have as much control as possible, right? I've lost a lot of control, so I want to be able to hang on to whatever control is still available to me and make now the best that it can be given the conditions of my situation. So there are conditions that are out of our control, like the weather, but I have the ability, and you have the ability, to adapt to those situations that are out of our control by putting on the right clothes, by putting on our boots, by taking an umbrella, by choosing not to drive today because it's really icy out there, or whatever the situation may be. It doesn't mean that I agree that it's fine. And that's what I think many people get stuck in terms of that word acceptance. That if I say that I accept that this is the way it is, then it's saying that I agree that it's okay. And that's not the same thing. It's just that holding on to saying I do not accept it is going to make the situation so much worse. You're going to waste energy. You're going to suffer more.
Diane, we have a question about that acceptance with pain, people who are suffering in pain.
Yes.
Can you give us some thoughts or advice on that? Because I think, when people are in pain, it's so much harder to accept and not want it to change, right?
Absolutely. And perfect timing with the question. Thank you, Jody. Thank you, whoever asked the question at the perfect time. my basic suggestion, or my basic skill that I teach people in terms of acceptance in general, and this is particularly relevant to pain and to chronic pain, is to learn to slow down by learning how to use a skill that has become a buzzword. So I don't know if it's really as clearly understood as it could be, but learning to slow down and to use a mindful approach. What mindfulness actually means is the ability to observe our thoughts, our emotions, our physical self, and other moment-to-moment experiences with kindness and without judging them or reacting to them. So let's just use the example of pain. When I notice that my back is hurting today and I'm having more trouble moving than I usually do, or than I did when I went to sleep last night, I need to slow down and put my attention on my body and look into it. And I use these words metaphorically, and I don't want you to go get an x-ray, but connect with that part of my body and see what's going on as best I can through the senses that I have to observe with. And then to respond to it and just describe what's happening. Oh, that pain is there again. I wonder if it would help if I took some deep breaths. I wonder if I can change my plans for how much I wanted to do today so that I have time to do the things that I know can be helpful when my back acts up like that. And letting yourself relax into it. Most of us have a reaction to pain that is trying to push it away. And I don't want to know about you. I don't want to see you. I don't want to feel you, and to get angry at it for being there. That is going to automatically make our amygdala, the emotional center of our brain, get activated, and it's going to send the signal, because the amygdala is the place in the brain that has the fight or flight response. It is vigilantly watching to see if you are in danger. And so if we react to pain by getting angry, our amygdala is not the smartest part of our brain. And all it knows is, boom, there's something going on. We must be in danger. So it sends the messages, produce cortisol, produce adrenaline, which is going to make all of our muscles more tense. And I don't know about you, but when my muscles get more tense, any physical pain that I have intensifies and gets worse. So the first thing that I do when I recognize that pain is back is I put a label on it. Uh-oh, pain is back. Okay. Take a breath. Pausing is really important in dealing with any hard stuff, really, with any strong emotional reaction, and certainly with any strong physical reaction like pain. Learning to pause so that we don't just go into overdrive and start to spin out and be upset about it, because that's just going to put layers and layers of more difficulty onto it. And if the person who asked that question has more questions about it, please feel free to go back to it. So learning to slow down. And there's a specific practice that I have learned and use and teach people, and it has an acronym, just like everything else in medicine. There's an acronym for these things too. And the acronym is RAIN, just like, you know, raindrops keep falling on my head. So R is just the recognize. Recognize when an emotion or a sensation is there, and put a label on it. Oh, the sadness is back. Oh, the pain is back. And then the A is just allow it to be there. And what I mean by that is back to the little example I just gave, don't engage with it. You don't try to make it go away. You don't talk to it and say, oh, please, 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 I don't want you today. Please, please, please. None of that. We don't engage with it. So it's kind of like what we say we should do with kids who are having a tantrum in the Target toy department. We don't want to reinforce that behavior. We want to just move on. So you don't engage with the pain or the anger or the sadness or the hopelessness. You just say, oh, you're here again. Okay. And I even sometimes get into a little imagery and say, okay, you can sit over there. And if you want a cup of tea, I'll make you a cup of tea. But I'm doing this today. I have to get this presentation ready. And I really can't have the time to talk to you right now. So allow it to be there. The I of the rain is inquiry, which can be helpful if you have the energy for it right then, to say, I wonder if I can figure out where this pain came from. Did I sleep funny? Did I forget to take my medication? Did I overdo it yesterday? And that way I might be able to learn something and prevent it from happening again or becoming more chronic. And the N is really the important part. The N is to nurture yourself with compassion, which is another tool that I'm going to talk a little bit more about as we go on, because self-compassion is really, really an important part of learning to live well despite living with chronic illness. And that makes me I'm going to skip over one part here and say that, especially given that someone asked specifically about physical pain, what's happening with your chronic illnesses is affecting your body. And everything that affects your body, of course, is going to affect every aspect of your life, as Jody said a few minutes ago. And it's fairly common for people to develop, without even knowing it, an adversarial relationship with your body, because it's your body that's making it hard for you. Why are you doing this to me? What's wrong with you? However, that just makes the pain or the fatigue or being overwhelmed intensify. And here's the thing about making your body the enemy in all this, the bad guy in all this. Your body is working as hard as it can every single day to do all of the things that you ask of it. And it may not have the ability to do all the things that you ask of it, but it's trying as hard as it can, given the fact that everything that's happening to your body is involuntary. Your body did not go out and order this from Amazon, just like you didn't. Your mind didn't do it and your body didn't do it. So learning to have compassion for your body is a really important aspect of learning to live well with chronic illness. Your body hurts. It's tired. It feels spent. And if your body were a friend, I have no doubt that you would feel a high amount of compassion for it. You would want to try and make your friend feel better. That's what compassion is. Compassion is a desire to reduce the suffering that we observe in someone else. So learning to observe suffering in ourselves and providing ourselves with compassion is really important. So I want to tell you a little practice that in the many, many years I worked for, I would say over 15 years providing inpatient psychological consultation on the acute rehabilitation floor, the intensive rehabilitation floor where people went after a long hospitalization to get their strength and energy back, or after strokes, or after many kinds of situations. And I provided that consultation in other parts of the hospital as well. But in the rehab unit, people were over the acute part of their illness, may have gotten over a transplant and weeks or sometimes, unfortunately, months of complications. And now here they were trying to learn how to do all the things in their life that they wanted to do again, sometimes learning how to walk again. And so I would go into people's rooms very frequently, and almost everyone was upset with the fact of what was going on with them. So I very frequently taught this little compassion practice, which was just 4 sentences. And I would teach it to the person and practice together. And then, because I do very low-tech interventions, I always carried around little 3x5 index cards, and I would write out these 4 sentences and tape it to the bedside on the rails of the bed, so that when people woke up in the middle of the night and they were alone and often anxious and often sad and having trouble falling asleep, they would see that little practice right there. And here's the cool thing about this practice. There has been a lot of research using what's called a functional MRI scanner. And a functional MRI is very different than the MRIs that I'm guessing all of you have been in, more than you want it to be. A functional MRI actually shows how activity within our brain changes in real time. So if you were in a functional MRI scanner and they put slides up saying, do these mental arithmetic problems, the part of your brain that does mental arithmetic would light up. And then if they took those away and there was a recorded voice reading you a story, the part of your brain that understands language would light up. So when they put people into the functional MRI scanner and had them do a practice that was similar to this self-compassion practice, what they saw was really remarkable. The activity in the amygdala, the fight or flight response, started to get quieter. And the part of the prefrontal cortex that sends the message to produce endorphins, which makes us feel happier and relaxed, that started activating. So what I learned from this research work is that just by focusing my attention and my thoughts in a different way, I can change the neurochemical balance in my brain and my body. And to me, that's like magic. All I have to do is focus on these kinds of words. So I'm going to say those 4 sentences for you guys. And if you want, and we have time later, we can go back to it, but it's 4 simple sentences like this. I was taught to do it by putting my hands on my body somewhere, because one other thing that we know very well from research triggers that same reaction, less cortisol and adrenaline, more endorphins, is physical touch. That's why when the baby is crying and we pick it up, it starts quieting down. That's why it feels so good to get a hug when we're upset. So these are the 4 sentences. May I be safe. May I be well. May I be happy. May I be at peace. And we can also use it for other people. I may want to send some compassion to a friend, so I bring that person's face into my mind's eye and I say it to that person. May you be safe. May you be well. May you be happy. May you be at peace. And the weirdest thing, you guys, is that even when I'm just teaching it, I'm saying it kind of by the way, I'm not really concentrating on sending it to myself. I can feel my heart rate slow down as I say it. So compassion for ourselves is really important, and making peace with our bodies is really important. It goes through my mind that anyone who has a chronic illness is getting ahead of what happens to all of us as we age. Our bodies are going to change. This body that is almost 70 cannot do what it could do 20 or 30 or 50 years ago. And so if we don't learn to adapt, if we don't learn to accept how to take care of our bodies as they change, we will continue to suffer. And for better and for worse, all of you who are living with these illnesses, you had it imposed on you perhaps earlier than anyone would have expected. I want to just, how much? Oh, we have a chunk of time left, but I want to make sure that there's time for questions, because in my mind, whatever information I'm able to give you is going to be much more helpful if it's in response to things that you are wondering about. So I really encourage you to not be shy. If you have questions, if you want to challenge something that I said, I hope you do that also. And having a conversation, I think, can be much more helpful in terms of information that'll stick with you and maybe be useful than me just kind of blathering on about things. But one thing that I do want to share with you is a quote and a couple of books. But the quote is this, and I thought I had it right in front of me, but I'm pulling out the book. And this was a quote by Joseph Campbell, who is an author. And he said, we must let go of the life we have planned so as to accept the one that is waiting for us. And that again goes to that really difficult concept of acceptance. So the book where I found that quote, which I had seen before, but of course had not remembered, was in this book, which I want to recommend to all of you. Toni Bernhard is an author. She is now an author. She was, before she became ill several decades ago, she was a very high-powered law professor at University of California, Davis. And she and her husband took what they thought was just going to be a long weekend trip. And she got what she thought was a touch of flu, a little bug, and she never got well. And she has since been diagnosed and has lived with for many decades an autoimmune disorder that has forced her to leave her profession and many other things. Her first book was called How to Be Sick, which I thought was just a great title, and that's what hooked me initially. But I'm really, really recommending her most recent book, which is called How to Live Well with Chronic Pain and Illness. And it looks just like that. If anybody wants to take a picture of that. It is practical information. It is just packed with fabulous information. One thing that I gleaned from this book that I did not share with you, and I would like to, I think is another one that's a stumbling block for most of us. Accepting help, and the even harder part of that, asking for help. And what Toni suggested in this book is that asking for help can be a gift to the people who care about you. Everyone that you know, I'm guessing, who cares about you has said something along the lines of, oh, if there's anything I can ever do, please let me know. Well, of course, you're not going to do that. You're not going to call people and say, what about this and what about this and what about this? However, on the other hand, they have said, let me know. And she suggests that asking people for very concrete things. She suggests that the more concrete you can make it, the easier it will be to ask, and the easier it will be for the person to say if they can do it or not. She says, for example, asking someone, could you possibly do my laundry once every 2 weeks? That's easier for someone to respond to than if you ask, could you occasionally help me out with laundry? She suggests making a list that's really, really concrete, so that when someone says, is there anything I can do to be helpful? You can say, well, actually, my son needs to be picked up on Tuesdays after his soccer practice, and I don't have the energy to drive by that time of day. So a very concrete request can be something that people would be so happy to be able to do, because then it lets them know that they are helping you. So learning how to ask for help. And the other part of that, learning to accept help when it is offered. That can just be really hard for many of us who have been brought up to be independent and, productive. So I'm wondering, if there are other questions that I can start addressing directly.
Yes, there is one. So the question is, a lot of having multiple chronic illnesses is around accepting living a life very differently than you, and you address this with the quote, the life you planned, but that it can just be really hard for to settle into the new normal. The question is about the new normal.
Yep.
So I know you addressed this some, but I didn't know if you had any other thoughts on that. And again, this is people, I think an observation is when you don't make the body the enemy, but you have one thing going on with the body, one chronic illness that's continuing, that it's not stopping, and then you have a second one. And that new normal is, again, it's not like it's almost exponential. It's not.
Oh, yeah.
You know
Oh,
what
yeah.
I'm saying? So
Yeah.
I think it's a great question that was asked, but I also would love to hear your thought about, like, it's just not one thing going wrong. It's two things going wrong, and you're managing it chronically. So it's continuous.
Absolutely. Absolutely. And there's other ways that can appear also. You may have, as many of you do who are listening, perhaps, two chronic illnesses. And then one thing that Tony talks about in the book is that you may be living with a chronic illness, and then you might get an acute illness. For example, she was diagnosed with breast cancer, and she went through breast cancer treatment for an acute medical condition, and she still had to manage her chronic illness.
Yeah.
And I think to whomever asked this question, I think that one of the most important pieces of being able to do this is patience. Patience with yourself, knowing that there will be ups and downs. You're not going to get to, there's no clear trajectory that then when you get there, then you will always be living well with chronic illness, as the title of the book says. It's not going to always be anything. In the same way that before you had a chronic illness, it wasn't always good and it wasn't always bad. However, giving yourself grace and being patient with yourself. I'm thinking of a woman that I have worked with for many years who was diagnosed as a teenager with Crohn's disease. And it's had severe impacts on her life, her education, professionally, relationships. And it is only now that she is in, I think she might be in her late 30s, that she is learning to be kind to herself and to be patient with herself, and to learn that putting work above her health is not a good choice. So sometimes it takes a long time of wearing yourself down. And she did that. She's done that. She's gone down so far that she had to leave her job. And then she's built herself back up and she plunged herself right back into it. And she is now, I'm happy to say, at the place where she has a much better understanding that taking care of herself so that she can take care of her son is much more important than working full-time and getting good job reviews. And that's come with some sacrifices because she doesn't have the income that she used to have. And Social Security disability is not a fabulous way to live. However, she has discovered that she is so much happier, even though she may have less materially. And I think that it's finding those ways of being patient with yourself, educating yourself and the people in your life, learning how to be mindful of what is important, learning how to keep your emotional balance. And I will just say that there are lots and lots of tools that can allow us, and they're different for different people. Some people find meditation incredibly helpful. I use a lot of meditative skills, but I have a terribly hard time sitting still on a cushion. So my meditation practices are much more like meditative walking and involve some kind of activity. We can learn to bring mindfulness, for example, into all of our daily activities and slow everything down so that when I wash dishes, which I happen to like doing, so I know I'm weird that way, but I really appreciate feeling the warm water on my hands. And then when I put soap on the sponge and it gets slippery, I pay more attention to those things because I'm putting my attention on the physical experience, the sensory experiences. And we can do that with any activity. We can bring mindfulness in and see, how does it affect our body? How does it affect our mood? How does it affect my level of worrying about something? Does it help control my tendency to ruminate about things that might or might not happen? When we slow down that way, we can figure out more easily what we need to do and find the tools that are helpful. And of course, I should probably put in a plug for the fact that if you are feeling more down than usual, if you do have a sense that your mood is being affected, whether it's by your physical condition or anything else, because life goes on. We may be living with a chronic health condition, and maybe we have a little bit of depression to go along with it, but we still have the world around us and the people that we care about who are going to be bringing other situations into our lives, and we want to be able to be present for those as well. So slowing down, learning some tools that can help us keep our balance, and if we feel we need more support, asking for it, whether that's from friends, from healthcare providers, seeking some kind of mental health support, all of those are available.
Yes. So we have a few more questions, and I want to just briefly answer two of them, and then you can add to them. But there's a big one that I think is important to end with. I think we're going to have to end with. One is how does the person know what to ask for, and asking for more tests when diagnosed. And I would go back to, so I'll just really quickly say, I would go back to the most important thing is to educate yourself about your disease and trust your intuition. So if you learn about the different tests you can get, the different treatment options, and again, on our website, Mended Heart's website, there's tons of information. You educate yourself about your disease, then you will know what test you can ask for. And if you're not happy in one place, get a second opinion, and also trust your intuition. If you feel bad, get it checked out. Like, don't let, too many people have issues and they don't get it checked out. Better to feel silly when it's nothing than to have something really serious going on and not getting it checked. So that's what I would say to that one. And then the second one is managing two different diseases at the same time. How do you balance kidney disease and heart disease? And so we are about to come out with a go-to guide that's going to be really helpful for that. And that's going to be an interactive guide, and that is coming out soon. But you do have to figure out the things that overlap between the two diseases. There are new medications for heart disease that are not damaging to your kidneys. There are kidney medications, diabetes medications that don't damage your heart. So you have to figure out that, and you have to talk to your doctor about things like sodium and phosphorus and things like that, and what you eat, because it is a balancing act and you have to find what's right for you. So that is a difficult thing. But the question I want us to end on, and we would be glad to provide more information. And again, we're coming out with all sorts of new resources for you. But is a person who is managing more than two chronic diseases, and she had a follow-up yesterday, or he or she had a follow-up, and the doctor said that this person just has to accept the fact that there may be no answers and that they don't know the cause. And this person is super frustrated about, how do you react to that? Like, if they have no answers, no plans, what do you do? And also they don't feel like their doctors care to find an answer for them. So that's a big question, but I think it's really important, and we just have a few minutes for you to answer.
Well, and there's lots of parts of that question too, Jody. I mean, the fact is that there are medical conditions for which there is no treatment.
Yeah.
And if a physician says we don't have anything that I mean, hopefully they say it with great humility and compassion. If there's nothing that they can offer, then you may ask, is there anywhere else that you would recommend I go? Is this where I go to the big places that I haven't gone to yet? And the managing, I'm not sure about the managing more than two chronic illnesses. I'm not sure.
Well, it's not that, I think it's just the frustration of not having an answer and not being able to make a plan, because you don't have a good path forward.
And that gets back to dealing with uncertainty.
Yeah.
There is not a clear understanding of what the cause is, then you deal with the things that you know. You can only do as much as you can do. And that sounds like a trite statement, but it's not. We can only deal with what we have the ability to deal with. If there's something else going on that is not clear, and I'm not quite getting my head around what this might be, if there are symptoms that are unexplainable, and you have a sense that your physician is uninterested, I think that's the sense I got from the question, then you seek a second opinion. You are not required to stick with a particular medical provider just because that's the person that you started with, or even if it's the person you've seen for many, many years. And I hope, and this gets really difficult with people who have specialists, right? So if you have a cardiologist and a cardiac surgeon and a nephrologist and an endocrinologist, and I hope that you also have a primary care physician with whom you have a very good relationship, who can oversee all of it and help you sort through this. Because you're absolutely right. The cardiologist is not going to be having conversations with your endocrinologist and your nephrologist and your other person. And so that's the role of the primary care physician. And that's why it can be so frustrating trying to find that right person. And I'll just say, from my perspective, I've had 3 primary care physicians retire on me in the past 10 years. So I now look for people who are significantly younger than myself.
Yeah, but I think your point, and we need to end, but I think the point is about when you're dealing with multiple specialists and they're like, I hear this all the time. My heart doctor is telling me it's a lung issue. The lung doctor is telling them it's a heart issue, and no one's claiming the disease. And that can be so frustrating. And I think just keep going, try to keep going until you find good answers. And someone does need to manage all of the things you're dealing with,
Right.
and find someone who can.
Right. And the other thing is that it is perfectly reasonable for you to be a kind of thorn in their side and keep asking them to speak with your other providers.
Yeah.
I'd really like to understand why you are telling me the opposite of what my nephrologist is telling me. I need you guys to, and sometimes that works. It won't always. And I understand that healthcare providers are under a lot of pressure as well. So but you are the best advocate for yourself, and you deserve to get what you need. And if the physician is a little bit annoyed that you keep asking, I say, oh, well, that's their job.
Yeah, it is. And so we want you to get the answers, and we really appreciate all of you who are on here today. Diane, this was lovely. Thank you so much for imparting all of this wonderful wisdom and the quotes in the chat box. So you guys have a great weekend. And again, thank you for being here. Bye, everyone.
Thank you.